Hello. Am I speaking to Maria?
Yes, doctor, I'm Maria.
Hello, Maria. Can I please confirm your age, please?
Yes, doctor, I'm 35 years old.
Hello, Maria. Is it a convenient time for you to talk?
Yeah, I have called actually to talk about some problem. So yes,
I
I
see.
can.
I see. So, can I confirm your address, please, too?
Yes, it is 34 Burlington Street, Oldham.
Are you in a private place so that we can talk as well?
Yes, you can, doctor.
Okay. Okay. So, if the phone line drops, may I call to this number again?
Yeah, sure, doctor, you can.
Okay. Okay. So, Maria, how can I help you today?
Well, actually, doctor, I'm having really bad pain in my leg, and I don't know what is happening.
I see. I see. I'm really sorry to hear about this, Maria. Are you comfortable to talk as of now?
Yeah, I can manage, doctor.
Mhm. Okay, so can you tell me more about this pain in your leg? May I know which side?
It's on in my left leg.
Okay, what about your other leg?
That leg is fine.
Okay, so can you tell me more about this pain in your leg?
Well, actually, doctor, it started yesterday. I was
Mm-hmm.
working in my garden, and all of a
I
sudden,
see.
I just felt that I have some pinching pain in my calf of left leg, and I just, saw my leg, and it was hurting really bad, and it's getting worse over time.
Ah, I see. I see. So, do you also does this pain go anywhere else?
Uh, it was just at the. I believe that it was in my calf yesterday, but now I can feel pain in my whole leg. So
Mm-hmm.
yeah, it
Mm-hmm.
is getting
I
worse.
see. I see. So, did you take anything for this pain?
I tried paracetamol, but it is not effective anymore.
Mm-hmm.
I've
I see. I see. So, apart from this pain, so sorry. Uh, can you can you tell me the character of the pain for me as well?
well, doctor, it is very sharp pain right now. It was not that
Mm-hmm.
bad yesterday, but now it's really sharp pain. And whenever I move my leg, I feel this pain, and I just can't walk. Actually, it's getting
Ah,
worse.
I see. I see. I'm really sorry to hear about this. This must have been very difficult for you, Maria. So, can you score your pain for me from 1 to 10, 1 being the lowest and 10 being the highest?
It is 6.
I see. So, apart from this pain, do you have any other symptoms?
Like what, doctor?
Like any fever?
Yeah, I today 2 hours back I felt that I'm having fever, so I took paracetamol. Now I'm fine.
I see. And do you have any shortness of breath right now?
No.
I see. I see. So so did you notice any insect bite?
I'm not sure, doctor, because I was working in my garden, and yeah, I wasn't I didn't took precautions. Maybe it is the
Mm-hmm.
reason, but
I
it seems
see.
to be like that. But I'm not sure. It's
Ah,
getting my leg is painful. I I'm not sure, but it seems to me a bit swollen too. And
I see. I see. I see. So apart from this, do you have any other symptoms as well?
um, I can feel that my left leg is getting swollen and is reddened somehow at
Mm-hmm.
the side and on my calf, and I just don't know.
I see.
I'm
I
feeling very
see.
bad.
I see. I see. I'm really sorry to hear about this. So you mentioned that you haven't been able to walk as well.
Yes, doctor.
Mm-hmm. Mm-hmm. So has this happened before?
No, it doesn't.
And do you have any medical conditions that I should be aware of, like any increased blood sugar?
No, doctor. I have asthma. It is relevant.
I see. So, is it well controlled?
Yes, it is.
I see. Are you taking any medications apart from your asthma?
No.
Do you have any allergies to food and drugs?
Yes, doctor. I'm penicillin allergic.
I see. Does anyone in your family has any serious medical condition?
No, doctor. Nothing I
I
remember.
see. I see. Have you recently hurt your leg?
No, doctor. I don't
I
remember
see.
anything else apart
I
from
see.
that.
I see. Do you smoke?
No.
See. So, well, may I know who do you live with?
I live with my husband.
I see. So, is your leg pain affecting your daily activities?
Yeah, it is. I'm a housewife and I have to move around the house and do my house chores. But right now, I can't do anything, and I don't know, doctor, what to do about it. Please help me.
I can see that you're in very much pain, and we are going to help you. Okay. So, uh, thank you for answering me. Now, I would like to take your vitals and do general physical examination, and then I would also like to examine your left leg as well.
Okay.
Okay, and also for the initial investigations, I would like to send routine blood tests. Will that be okay?
While being on phone, how will you send all these investigations, doctor?
Oh, okay. So, Maria, do you mind if you come to the clinic so that we can take blood from you as well?
Okay. So,
Okay,
doctor,
and
what's happening
yes.
to me?
Okay, so I can see that you are very concerned. So from our assessment, it seems that you might be having, you are having some swelling and also redness in your leg. So, from our assessment, it seems that you might be having this condition called a condition called cellulitis,
What is that, doctor?
which is the infection and then the inflammation of your left leg.
Okay.
Okay, so there could be many triggers to it. One of them could be, we are suspecting that one of them is, and you were doing gardening at that time, so we are suspecting that this could be due to an insect bite.
Okay.
Okay, so right now I would like to give you some painkillers for your leg pain.
Okay.
And then I would also um, like to draw some blood from you. Sorry.
Okay. All right. Should I give the review right now or
Yes,
afterwards?
doctor, please.
Yes.
Please, if you could, please.
Okay. So, Dr. Aisha, am I pronouncing your name correctly? Hello.
Yes, yes, you're pronouncing my name correctly.
Saima, you had mock with Khain, not Aisha.
Hi. There were two people you mentioned, Kain or Aisha.
You
I
had
just
you had
forgot the
Khain.
name. Okay. All right. Because Kain, you haven't introduced yourself in the beginning well. The call was connected. First of all, starting from that. So that and okay. I would say ask. There are a lot of things that you did really good, but there are some really important points, especially of telephonic consultation, that you have missed.
Okay, doctor.
So first of all, I would talk about the good things. The good thing is that you, in the first 1.5 minutes, you have an idea that what it is going to be. Because I told you
Yes,
that I
yes,
am having this pain.
yes.
Yeah, so that's a good thing that you were able to make a diagnosis very early in your consultation. And in this in such cases, when you have telephonic consultation and it is mentioned in the station that the patient has emailed you a picture,
Yes,
most likely that
I
picture will be
forgot
in
that,
front of
doctor.
you.
Yes.
Yeah. So no, don't worry. In the exam, most likely the picture will be in front of you. The moment you will
Okay.
enter the station, it will be there. So you will have an idea from the very first minute that what it is going to be. The other
Okay.
thing is that you have to keep your composure all the time, and you do not have to give an idea that you know what it is. You have to do it just the way you will consult a woman with pain in
Okay.
leg. Okay.
Okay. Okay, doctor.
So it is very evident from the very first minute that you know the station, and you were not scripted, but your pace was really slow in the beginning.
Oh,
And
yes.
it was at one point I felt that you have lost the structure of your consultation and data gathering. So please work on your pace. And the next thing is that always acknowledge the patient and empathize with it. You have to work. You should work on your tone.
So,
You are not monotonous, but while if you are once you are near your exam, or you listen some written talking, they whenever they are talking on the phone, they have a different way of style. They have different way of talking, they have different style. So that makes the other person comfortable. So when you are talking to someone on the telephone, when you have to say that, doctor, I'm having very pain. Oh dear, I'm so sorry to hear that. It must be really
okay.
troublesome. So you have to, I know that it seems to be in the very, sometimes that it is not me, but you have to do it.
Yes. Yes.
Okay.
Okay. Okay. So
And
empathy, sympathy, I need.
it tone was not very flat,
Yes,
but
yes, yes, yes,
lot of
yes.
it. The way
Okay.
you are talking right now, this is absolutely fine, but you were not, you were think, and at the
Yeah,
same
I
time.
was a little bit stiff in there. Yes.
Yeah, yes. And first I will talk about data gathering. You didn't complete your Socrates was not structured. You asked
Yes.
almost all the questions, but your Socrates was not structured. It should be very structured, because the simulators there, they they are also just the way you are. We think that we don't have to sound scripted, but actually you will, when you will go for the exam, you will got an idea that they are even more scripted than you. Because if you ask this question they are not aware of, or you change the way of asking, they will get confused and they will ask you that what do you mean, doctor? Or he will ask you, please repeat the question in a very scripted manner. So um, they have always have some hints for you. So you have to stick to the structure, and while asking the scripted questions you have to work on your tone. Your tone
Okay.
should be natural with your scripted questions, because you already know that it's a station of insect bite.
Yes.
Okay.
Yes.
So and regarding the data gathering, the first part of the telephonic consultation of data gathering is uh, gathering the patient's information. You
Yes.
didn't introduce yourself. You said that, am I talking to Maria? I said yes. You asked me, can you please confirm the age? And then you asked me about my
Oh,
residence.
yes, yes.
You nowhere you asked me, you said to me that, hi, hello Maria, it is nice talking to you. Okay, I have to confirm some information. You asked me twice about that, is it the can I talk
Convenient
to you
time for
right
you to
now?
talk. Yes,
Yeah.
yes,
Uh,
yes.
because the call, I mentioned in the station that call is connected. That means that she is calling you. That means that this is the appropriate time for her. You are not calling to the patient. The patient
Okay.
is calling you.
Okay.
Okay. So
Okay. Okay, doctor.
so you have to keep that in your mind. So
Yes.
you have to ask these questions, but you have to ask it in a more in a way that, for example, the call is connected. You will say that, okay, so hello, Maria, how are you? I have to confirm a few information from you before starting the consultation. Is that okay? She will say, okay. Can you please confirm your age and first line of address for me? Save your time.
Yes.
Save your time. She will tell you both things abruptly, and then say, okay, in case the call drops, can I call you back on this number? All right. So as the call is connected, it's my way. Anybody else might have some different way of approaching, but I say that it's I'm sure. So we can talk right now. Is that fine with you? After confirming all the information, in case the call drops, I used to do that. So she will say, yes, yes, doctor, because now that I have asked all the questions, I am going to bombard her with questions. Okay, so before that you just confirm that. So it seems to me that it's the right time to talk to you. In case you are calling, then you will ask in more formal way, is it the right time to talk to you? Are you in a private place where we can talk about, right?
Okay.
All right. And then the Socrates. You asked me, your pace was very slow while asking me about the Socrates questions. And and that when I told you about my pain, that was the first point. You have to show your empathy. Okay,
Yes.
because
Okay.
that is the most crucial point. You do not show any empathy in the whole consultation, but you show the empathy at the point where the
मैं तू
patient
भी थोड़ी देर आंखें बंद करके सो जा, फिर शाम को देख लेना. आंखों को रेस्ट देने की बात हुई थी ना अपनी, मैं फिर बंद करवा दूंगी टीवी.
Hello.
Hello, whoever
Yeah.
is
Hi.
introduce yourself. Okay, so at that point of the very first point, when she said that I'm having pain in my leg, you should show your empathy in a very, very good tone. Oh, I'm so sorry to hear that, Maria. Are you comfortable to talk right now? Okay, so can you please tell me more about your pain? When you say that, can you please tell me more about your pain? He will give you some story. If you will, okay, doctor, I was gardening and all of a sudden I felt pain in my leg, and and you will say, okay, oh dear, it seems very bad. So which leg are you talking about?
Yes.
This way,
Yes.
you in the very first and 2 minutes, you have to build the rapport with the patient, and then they will start talking because they are more scripted than you, believe me.
Okay.
All right, and after the Socrates, there were red flags.
Red
In red,
flags.
yes, you have to ask me. After Socrates, there's a question that I have learned while doing the stations with Kuratlan. Actually, that the question anything else is very important, and I can't emphasize on it anymore. That anything else question after Socrates is really, really important. So that question was missing. And because if there is anything else, she will tell you, and that will save you. If she says that no, that means that there is nothing.
Okay.
But still, you will ask 3 to 5 red flags.
Okay.
So if you say will say anything else, and she wants to tell you something important, she will say like, what, doctor? Okay. So you will ask any fever, any swelling, any redness, and you will ask about any breathing difficulty.
Yes.
Okay, you will
Yes.
ask about any rash over your body, or you will ask about the question that you asked in the end, that how has it affected your life, you can ask that question here too, while showing empathy, that oh, it seems that it's really affecting you nowadays, or it's really affecting your daily life. Okay, there are two
Yes.
ways, whatever is fine with you. Afterwards, go for differential diagnosis. In your case, you know the diagnosis, but it's really important to ask 2 or 3 differential diagnosis. You asked me about did you hurt yourself, but you asked me at a very last point, and I was expecting that a bit question a bit earlier after the red flags, that you asked me about
Okay.
the DDs. By any
Mhm.
chance, did you hurt your leg?
Yes,
By
yes,
any
I
chance?
forgot. Yes,
Yeah.
hurt
So
yourself,
you asked me
trauma.
all of the questions. Yes. You
Yes.
asked me about almost every question, but the consultation in the very beginning was not structured. It seems to
Structured,
me,
yes.
yeah, it seemed to me
Okay.
that you are thinking and asking at the same time. So
Yes.
yes. So this is the thing that you all the plappers have to work on. And afterwards, you asked me about the medical conditions, but you were not very confident while asking that question. You
Mhm.
asked, you said that, do you have any diagnosed medical condition like high blood sugars? If you are saying like high blood sugars, then only high blood sugars is not something you have to mention. Either don't ask or name a few like high blood sugars, high blood pressure, asthma, or anything else like
Okay.
this. Do not ask incomplete questions. Either ask, do you have any diagnosed medical condition? And she will give you the relevant information she has.
Okay,
Or
doctor.
ask, do you have any diagnosed medical condition like high blood sugars, high blood pressure, asthma, or anything else? She will tell you about any medications you are on. She will say any known allergies. Okay.
Okay.
So this is how you will ask. And while asking the question, be very confident, because
Mhm.
and try to keep your your approach should be very structured. And afterwards, I would say that you have to work on your IPS, uh, because while talking normally, you are talking really well. If you are able to do the consultation this way, that would be fine.
Okay.
And the most important thing, the third thing about your consultation is management. You forgot that it is a telephonic consultation. That is a quite common
Yes,
mistake.
yes.
Yeah. So in these telephonic stations, if you have to disclose a result that will be available to you either outside the station or inside the station, and you have to talk about it. Okay.
Okay.
um, so you will have that information in front of you uh, when you start doing the consultation. Nobody will come in between the consultation, just the way we do in these stations. Nobody will come inside the cubicle when you will say, I would like to do some investigations and hand over you. No, there will be some uh, investigations. If they want you to talk about the investigation, there will be some investigations done prior, and you will have the reports at that time in that in the cubicle. And just like in this setting, she has emailed you a picture.
Mhm.
Okay.
Mhm.
So the best approach for for a telephonic consultation is that you will tell him that from the conversation we had, Maria, on phone, it seems to me that you are having a condition called cellulitis, and from what you have told me, it seems to me that it is because of some insect bite you have while gardening. Now you have to pause. You have given her two informations. You have given her the diagnosis, the cellulitis, that is quite evident
And
from the
also the
picture,
trigger.
and also the cause.
Yes, cost.
Because if you tell her that it is cellulitis, the next question will be, how did it
How
happen?
did I get it? Yes.
Yes. So you have to save your time by
Mhm.
by telling the person a lot of information in fewer words. Okay.
Okay. Okay.
She can ask me, doctor, what is cellulitis? No, it is infection. Your leg is having infection right now, so
Yes.
that needs to be treated. So
Okay.
what would be?
Infection.
Oh, she will say, okay. So you will say, what is the best would be that you come to the hospital, and we will have a closer look on your leg, and we will give you some painkillers for that, and might prescribe you some appropriate antibiotics. You didn't mention antibiotics anywhere,
Yes. Yes.
because I mentioned that I'm penicillin allergic. My next
Yes.
question would be that doctor, which medications you are going to give me antibiotics?
Mhm.
Okay, so this is the next question I'm going to ask you. But if you are sharp enough, you will say that we will prescribe you appropriate antibiotics, keeping your penicillin allergy in mind.
Yes.
Now that you have saved your time again. Okay.
Okay. Okay, doctor.
And you have to check in the management strategy is check and junk. You will give her some information, take a pause. If she has a question, she will ask. Otherwise, she will say, okay, all right. She will give you time to talk. But you, in the telephonic consultations, it is this way. And when a person, the telephonic consultation, you can, if there is something common ailment, you will say, I
Yes.
will send you the prescription of the medications via email. Okay.
Mhm. So,
She's not
doctor,
going to send to you.
yes,
Mhm.
we still need her to come to the clinic so that we can check on her leg. So it is safer to, I mean, is it always safe to say, can you come to the clinic so that we can take a better look at your condition?
See, cellulitis, she had a fever 2 hours ago. She took paracetamol. That
Mhm.
means that she's having infection,
Mm-hmm,
you know.
mm-hmm.
And
Yes.
you just saw a picture. You don't know
Yes.
that when did she take that picture.
Yes.
You know?
Yes.
If you think that it is something that could deteriorate, you should call her to come. You should ask her to come to our GP.
Okay.
If she says that I'm having headache and I am having this headache because of the migraine, then you don't need to ask. There's no need to ask her to come to the GP or hospital. You know, she will take the medication. She will be fine. But infection, cellulitis is something. She might need IV antibiotics, depending on the condition of her leg. We have to examine her leg, and she's
Yes.
not able to walk. That is also
Yes,
a red
not
flag.
walk. Mhm.
You know, the red
Yes.
flags are there. She's having fever. She's not able to walk. It is getting worse. So these are the red flags.
Yes.
So that is the reason. I would suggest you to work on 2 things. First is try to have your your consultation more structured and work on your IPS,
Okay.
because you are not able to complete your management. And if you the person who will do well in management, who will pass the exam,
Okay.
period. Because all of the people taking the exam will get similar marks in their data gathering,
Mhm.
because all of them know that what questions they have to ask. Someone will be a bit better, someone will lack a bit, but the management and how are you dealing with that person, your IPS, these are going to mark you as a passed candidate.
Okay. Okay. Okay, doctor. Thank you so much.
Do you have any questions for me?
No. So here, doctor, I just want to ask a few things. So the DDs here is trauma, and then maybe PE, yeah,
Mhm.
PE trauma,
Yeah.
and then
Pain,
just that.
coughs,
Yes.
travel history,
Yes. Travel
yeah,
history.
trauma, PE. These are these are the 2 most important DDs. Apart from that, you can ask her. She's having joint pains. You can ask about the joint pains. You know, you have
Yes.
to
Yes.
cover the DD. The 2 most likely DDs are trauma and
Septic arthritis.
so you just have to ask about any joint pain in your joints.
Joints.
That's it.
Yes.
You have 3 DDs or more than if you
Okay.
know the diagnosis.
Okay. 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 Thank you so much, doctor.
No problem. No problem. Thank you.
Thank you.
Bye bye. Okay. Also,
Thank you so much, Dr. Saima. It was a very, very good feedback. That was, I liked your feedback. And that was to the point and really good. So we will start the next station, but after a new, I have to start a new meeting. I'm sharing the link. Please join back and then we will be continuing.